If I were working in an acute medical setting, the first type of advocacy that I would encounter as a graduate registered nurse would be collaborative. So in this instance, there would be a patient that may not feel empowered to be able to make decisions on their own, whether that be due to not feeling comfortable around the health professional staff. Perhaps it could be a lack of knowledge or a lack of being able to verbalize the knowledge that they do have. So in this case, I would discuss with the patient what the outcome is that they want, perhaps trying to explain medical terms in more colloquial terms for them so they are able to understand, and then have the empowerment and the ability to be able to advocate for themselves in a sense. So it would kind of just be more of a supporting role to the patient, and in turn making it more patient-centered care. So that would be the outcome of that one. The second form of advocacy that I would take part in is potentially a more passive form of advocacy, in which if myself as a graduate registered nurse or some of my colleagues who are also registered nurses or other healthcare professionals don't necessarily agree with the course of treatment that is currently occurring for a patient, the first line of action would be to advocate for the patient via a line manager. So as a graduate registered nurse, a preceptor or the NUM perhaps. So that type of advocacy can be confronting because you're going against someone who is respected within the area that you're working in, and obviously as a graduate registered nurse, I am kind of the bottom of the professional food chain, so it would be difficult but very necessary, because sometimes things can be missed, we're all human, and that would be the second type of advocacy. So the outcome would be that even if it doesn't change the course of care for the patient, at least there is attention brought to possible knowledge gaps, treatment gaps, ensuring cultural safety, all that kind of jazz. Thank you.